Hello and welcome. My name is Zaffar Iqbal and you're watching the Mojo Story. According to a World Health Organization report, India has reported more than 4.7 million deaths due to COVID, which are thought to have actually died because of COVID-19 pandemic. We've seen different waves hitting the country. Now, this is uh, almost 10 times higher than the official records. Now, India has clearly rejected those figures and has questioned the methodology that was employed by the WHO. In fact, the rebuttal has come from the Indian side. But to get a better understanding about the subject and about these figures, we are today joined by Professor Gautam Menon of the Ashoka University. Sir, welcome to the show. What's the sense that you make from this WHO report?
WHO report says that India has had about 4.7 million deaths roughly from COVID-19 across the period of the 1st of January 2020 to the 31st of December 2021. That number of 4.7 million is about 9.8 times larger than the official government figure of deaths for that period. And that's the reason why the government is questioning the, the numbers behind that and the estimates that led to that particular number.
Yeah, there is a wide gap between the government figures and the figures that have been given out by the WHO. Why is there such a big discrepancy according to you?
I don't think there is any serious doubt that deaths have been undercounted in India, that the
Yeah.
government figures of about 500,000 odd are really an undercounting of the actual number of people who died from COVID, either directly from COVID or indirectly as a consequence of COVID.
Yeah.
The only question is what is the level of undercounting? Is it a factor of 2, a factor of 3, or a factor of 9.8 as the WHO suggests? Most estimates for the undercounting of deaths suggest numbers somewhere between 3 million and 6 million compared to zero point 0.5 million. That is the official figure. So that's a multiplying factor of somewhere between 6 and 10 or 12, which is
Yeah.
the number, the range that would normally be expected. And the WHO figure falls pretty much in the middle, perhaps a little towards the upper end of that range. I would personally favor a number closer to about 3 million, but there are many uncertainties in assigning the nature to a death to a COVID case. And it's these uncertainties that play into the differences between the different types of models and the data that is derived, that is used to be supplied into those models.
Exactly. The government has questioned the models and the methodology. What exactly is the methodology that's been used by WHO? We know the government system. There is a system of registration of the deaths that could have helped to account for the total number of COVID deaths. But what is the methodology that's been employed by WHO that's been questioned by the government of India?
So the WHO is employing a fairly standard statistical methodology. They have
Yeah,
employed a group of outstanding academics from across the world who have
yeah,
participated in developing that methodology, and they have interacted with governments across the
yeah.
world in order to refine that. So I don't think there are serious problems with the methodology itself. And in fact, even the government's sort of attempts to contradict what the WHO has said has said, models cannot be trusted, models cannot be used for this particular purpose. But that is largely untrue because it is modeling that lies at the foundation of many of these estimates, and it's a model that applies equally well to countries across the world. Not only that, there are many independent estimates of the nature of the
Yeah.
undercounting. All of these are roughly in the same ballpark, somewhere between a factor of 6 to a factor of 10 or 12 between the recorded figure and potentially the actual figure of COVID-19 deaths. It's this consistency that we should be looking at. It's not just the WHO estimate, but the fact that many other estimates are consistent in the broad ballpark with the numbers that the WHO has put out.
So yes, it's not just the WHO report, but other independent estimates have also suggested that the numbers are much more than given out by the government. But one of the points that the government side can say is that not these 40 lakh people have come, their families have come to seek compensation. Actually, if that would have been the case, then lots of people would have turned up and asked for compensation. That's not happened. That's one of the logic that is being given out by the government.
No, but that's not completely true because in many states, the numbers of people applying for compensation for COVID deaths
Yeah,
is significantly larger than the number of people who are recorded as having died of COVID.
yeah.
And states have admitted this. I mean, states are paying out compensation based on the requests that they have received. So certainly states do understand that there has been an undercounting, and even the scale of that undercounting is roughly consistent with what the WHO says. All of these are in a rough ballpark, and they're also consistent with what came out of news reporting from that time. So the fact that many deaths were simply going undercounted, which really should have been counted as direct COVID deaths. Forget even the indirect COVID deaths.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.